तौबा तौबा।
इतना बड़ा जब अपना बूंदा करके आ रही है तो बता तेरे वगैरह से करने वाले दिख नहीं।
Assalamualaikum everyone. We are going live, so kindly mute yourself.
अनावा जी को चाय वगैरह बना दूं? कुछ चाहिए?
लोगों को स्लाइड्स sir, just 2 minutes we are sharing.
सर स्लाइड्स में शेयर कर देती हूँ। सर
Assalamualaikum everyone. A very warm welcome to all of you. I hope you all are doing well. I'm Nadia Khalid, a fourth year MBBS student, an honored LP of MSc Pakistan from Mahid Islamic Medical College. It's an
Walaikum
absolute pleasure
Assalam.
to have you all. Guys, kindly mute yourself. This is me, Aisha Anwar, and I'm coordinator of this session.
Assalamualaikum. This is Nashwa Shakur and this is MIMCLC.
Okay, guys, we will wait for further 5 minutes to join. Then we will start the session, inshallah. Okay, guys, now moving forward with our session, it's my absolute pleasure to welcome and introduce our esteemed speaker, Dr. Malik Shahriyar, medical specialist, Holy Family Hospital. We are honored to have him with us today to share his valuable insight. Welcome, sir.
Walaikum Salam. Thank you so much, and it is an honor for me to join the session.
Okay, now I would like to warmly welcome sir to begin the presentation. Over to you, sir.
Assalamu alaikum. Should I begin or we will wait for someone?
Welcome, salam, sir. Yes, you should.
Okay, who are the guest audience? Can I get to know that? Means on the other side there are students or professionals, or who are they on the other side?
Sir, mostly they are students.
Okay, mostly they are students, so that I can just come at their level, and I will try to just mention the facts, and I will try to keep this presentation in a way that they can just diagnose, or they can see the signs and symptom of diabetes, and they can guide about the treatment whenever they have a patient at their home or in the relatives, so that they can at least guide them. So we will keep it at that level. Okay.
Okay, sir.
Okay, so sweet success, mastering diabetes management. As you all know that diabetes is a real threat and it is an epidemic, and recent lifestyles, dietary habits, lack of exercise, and the family history obviously, and the risk factors, and with the changing environment, the climate change is the biggest threat that is bringing certain changes in the genetics, so that leads to the increase in the cases of diabetes. Next slide. Okay. So I think we should open the mic for. We would have to open the mic for them to check their basic knowledge. Actually, who thinks that physical activity alone can manage type 2 diabetes? You can any idea about the symptoms of hyperglycemia, or guess the average fasting glucose level in a diabetic patient? Are we supposed to check their knowledge at this level, or we should move on with the slides?
No, sir, we can check their knowledge. Guys, please respond. You can unmute yourself one by one, or you can respond in the chat box by typing.
Yes, this is a good way. They can respond in the chat box. So it will be good, and it will keep the decorum of the presentation as well.
So about the symptoms of hyperglycemia, it includes polyphagia, polyuria, polydipsia.
Yes, okay. And anything else? Okay, you have mentioned three symptoms. Okay, good. Uh, Average fasting glucose level in a diabetic patient.
Around 100.
No, fasting glucose average, obviously 126 is the cutoff for diagnosis. So more than 126, somewhere it will lie more than 126. And can the physical activity alone manage type 2 diabetes?
No, lifestyle modification is important.
Okay,
Proper
overall lifestyle modification you are talking about.
Yes, sir.
Okay,
Yes,
good.
with dietary restrictions.
Okay, good. Oh, and people with diabetes can never eat sugar. Actually, it is better that they should avoid sugar, but they are getting sugar in different forms. Like if someone, if we talk about a Pakistani citizen, if they take wheat, like roti jo aap khate hain, so that ultimately breaks down into the glucose when it is digested. So yes, they do take sugar, but that the moderation is important. Raw sugar should be avoided. Next slide, please. Next, okay. So diabetes is a chronic metabolic disorder causing hyperglycemia, results from insulin deficiency or resistance. Oh, okay, so generally at your level, I would say that there are two classes of diabetes. The type 1 diabetes, that is usually from the childhood, and that occurs due to the deficiency of insulin, means there is absolute absence of insulin in the body. Okay. And the type 2 diabetes, that can originate at a later stage in the life, like uh, 35 plus, 40 plus. Okay. And it usually there is the production of insulin, but the insulin is insufficient to control the levels of sugar in the body. Okay. So you just take the help of insulin, or the medicines that can regulate the insulin functioning. Okay. Like for example, a few medicines, they increase the sensitivity of insulin so that insulin can act in a better way. Few medicines, they just reduce the fat in the body so that the resistance can be decreased. And like the newer class empagliflozin, the newer class empagliflozins, they are SGLT2 inhibitors. Empagliflozin, dapagliflozin, they just throw the glucose out of the body via urine. When the person micturates, the sugar is just removed from the body. So there are different types to augment the role of insulin and help the body with the regulation of diabetes. Next slide, please. Okay, I would suggest that I would quickly go through the slides first, and then we will discuss certain few points in general that you must look towards in your daily routine life, so that you can easily handle the cases of diabetes, and you can guide your people around you. Okay. So I will quickly go through the slides first, and then we will open the house for the discussion. Okay.
Okay, sir.
So types of diabetes, there are they, as we have discussed. Type 1, autoimmune destruction of beta cells. Beta cells in the pancreas, they produce the insulin. So destruction will lead to the insulin absence. So type 2 is the insulin resistance plus beta cell dysfunction. Lifestyle and medicines are used to just treat this condition, as I already told you. Pregnancy induced insulin resistance lead to gestational diabetes. Next slide. Okay, pathophysiology, as we have already discussed, no insulin production versus resistance. Next. So the risk factors, yes. In the actually, type 1 is the type 1 and type 2 both are transmitted via family. So they run in the families. Type 2 is basically an autoimmune condition. So risk factors are some other autoimmune conditions, like someone with hypothyroidism, hyperthyroidism, any disease of thyroid, any other disease like rheumatoid arthritis or else. And family history, viral diseases, autoimmune disorders, they all relate to type 1 and type 2. Obesity, sedentary lifestyle, poor diet, genetics, and gestational overweight person is already predisposed to diabetes. So I will discuss at the end how the obesity causes diabetes, and then it also halts the treatment of diabetes. PCOS, previous large baby. So these conditions definitely are the risk factors. Next slide. So symptoms, as discussed by someone initially, that polyuria, polydipsia, polyphagia, then there is unexplained weight loss, fatigue, because the body has the sugar but it is not being utilized, and the main nutrition, main energy source of the cell inside the body is glucose. So when the cell won't get glucose, definitely it will feel lethargic, fatigued, blurred vision, slow wound healing. Slow wound healing is actually definitely a symptom of the insulin resistance or the diabetes. Next. Okay. So we have fasting blood glucose of equal to or greater than 126, HbA1c. Okay, HbA1c of 5.7 or less is the normal. 5.7 to 6.4 is the pre-diabetic range. It means you can develop insulin resistance, you can develop diabetes in future, and you are at a higher risk of developing the diabetes when your HbA1c is 5.7 to 6.4, and greater than equal to 6.5 is definitely the diabetes. OGTT is the oral glucose tolerance test. 2 hours plasma glucose means after 2 hours you check the plasma glucose, and if the levels are more than 200, then the diagnosis is established. Random blood glucose of greater than 200 also establishes the diagnosis of diabetes. Next. So complications. There are a wide range of complications, and you divide it into microvascular and macrovascular. Microvascular complications are the ones that play major role, like retinopathy, nephropathy, neuropathy, and you may encounter patients with diabetes who come across blurred vision. Also, there is a glaucoma, and keep in mind one point, that how there are people with nephropathy, means their kidney is not functioning normally. How will you check that whether the nephropathy is due to the diabetes or it is due to some other factor? So the most important point in this is retinopathy. So you will examine the retina. If there is retinopathy, then then and retinopathy and nephropathy, then it can be suggest that there may be diabetes which has caused the nephropathy. But if there is nephropathy and there is no retinopathy, then it is less likely that it has been caused by the diabetes, because retinopathy occurs first, and then other complications occur like nephropathy, neuropathy, etc. Okay, so this is the way of diagnosing the nephropathy. So retinopathy, nephropathy, neuropathy. Neuropathy. What is neuropathy? You may come across patients. They tell diabetic patients who tell about the tingling sensations, burning sensations, numbness in the palms, in the sole, and there are different kind of sensations in the body. They are known as the paresthesias. Paresthesias are the abnormal sensations. Okay, means for example, I am feeling burning sensation in the foot. Okay, so this is abnormal sensation. There is no fire around that can cause the burning. Okay, when you will encounter fire, it can burn. The heat of it can induce a burning sensation. But when in the absence of fire there is a burning sensation, it is known as paresthesia, abnormal sensation, because the sensation is not there. The thing causing the sensation is not there, but the sensation is there. Okay, so these different types of things lead to neuropathy. Then there is macrovascular like CVD, stroke, cardiovascular risk, and there one thing more. Have you ever heard about the peripheral heart? Anyone? The peripheral heart is the calf. Your muscle is the peripheral heart. Okay, so okay. So peripheral heart. So what will you see in the periphery? Look, in the heart, you have the circulation of heart, cardiovascular circulation. Okay. So definitely, if there is a peripheral heart, there will be circulation there. So what will that circulation cause? The any disease of that circulation called peripheral arterial disease. Okay. peripheral arterial. So diabetes can cause peripheral arterial disease as well. That is also the cause of microvascular level. So yes, and type 1 diabetics, they are very much prone to DKA, diabetic ketoacidosis. And usually the patients are diagnosed for the first time with DKA. They develop the DKA and they are diagnosed. HHS is the hyperosmolar state, and hyperglycemic hyperosmolar state. And it is usually the disease of the old people with very much uncontrolled diabetes, more than 600 value of the glucose in their body, BSR. And usually if they are deficient of hydration, they don't take water properly, they can develop this HHS state where they can develop the altered sensorium, confusional state, and they can go into the coma as well. Next. So management overview. Okay. If there is one thing that can help you treat your diabetes, is the lifestyle modification. That is very much important, very much pivotal, and only medicines will not be sufficient to provide you the optimal care. Okay. Lifestyle modification includes proper exercise. And what is that exercise? The exercise, according to the research, it is actually the 150 minutes of rigorous activity in 1 week. 150 minutes. And it doesn't mean that you exercise for 150 minutes in a single day and then you just sit idly for the next 6 days. It means that divide 150 minutes divided over 1 week. So almost 22 minutes, 20 to 25 minutes, that is the range I usually prescribe my patients. That they, and what is rigorous activity? Either you should do the brisk walk, means fast steps, or you must take the go for the jogging or running. So this is the rigorous activity. Okay, the simple walk won't help you. This rigorous. Okay, the rigorous activity. So the only simple walk will not help, and this rigorous activity will help you reduce your cholesterol levels. It will reduce your blood pressure levels. It will reduce your diabetes levels, and you will feel agile and active. If you people look, these days the life is very busy. In case of students, you go through different exams, you have a syllabus to cover, then you just there are video games and penalty of options, screen based options that doesn't let you go out for such activities, rigorous activities. And as far as the people like me who do job, the economic situation of the country is clearly evident to you, and the people are doing 2 jobs, 3 jobs. So what happens is that on the workplace you are not getting sufficient time to carry on the routine activity or exercise. So this has led to the sedentary lifestyle, the, and also the fast food. Okay, fast food is very much, and the world over the world is coming back to the roots. They are now focusing on organic diet. You must have heard that usually people in the past, they used to have the raw vegetables, like concept of salads these days, also raw fruits. They were the part of their diet. And the fast food that is rich in the fats that are not required for the body, so that is definitely causing the cardiovascular events and diabetes and obesity and everything. So the first of all, the lifestyle modification is important, and the one interesting fact that I would like to tell you is the oral hygiene. Oral hygiene is very much important to prevent diabetes. Poor oral hygiene can also lead to diabetes. This is the recommendation in the recent ADA guidelines, American Diabetes Association guidelines 2025. So they are focusing on oral hygiene as well. Okay. And then there are medications. Okay, previously there were the guidelines about the medications that you must start with the metformin and add on, then later you go for the add-on therapy. But now the recent guidelines recommend that the treatment should be tailored according to the needs of the patient. Whatever that patient needs, you must start that treatment. There is no set rule now that this medicine should be started first of all. Okay, so there are several groups like that one of metformin, sulfonylureas, and the pioglitazones. Pioglitazones have a side effect that they may cause heart failure. They may precipitate heart failure. And newer form, the SGLT2 inhibitors, this is the remarkable change in the diabetes management. Usually the HbA1c of 10, 9, 10, that was considered to be untreatable on the oral medicines, but now the diabetes is treatable due to these newer medications. And also there is advancement in the range of medicines that are available. And for obese patients, now you have the semaglutide. Okay, GLP-1 agonists. Okay, and that is a weekly injection. That is very easy for you. We will take the questions at the end. Okay, that is a weekly injection. Okay, and that become a look how easy the management has been now. Only one injection per week. Isn't it an easy job to do? Okay, so the treatment options are being modified and tailored according to the needs of the patients. Monitoring, yes. Nowadays, standardized monitoring is being advocated. Standardized monitoring means the devices, CGMs, continuous glucose monitoring. These devices are installed in the body of the patient, and they, through AI, artificial intelligence, they continuously monitor the glucose. And now there are even devices that monitor and administer insulin according to the sugar values. It means if your sugar value goes up, the insulin, extra insulin is injected into the body automatically. So these are AI assisted devices, and already the values are fed in them so that they can just deliver the insulin whenever required. This is the natural way. Means in your body, whenever you take the food, insulin is released in the normal patients. And now we will talk about the education and support. Education is must. uh, the lack of education, okay, when you guys will start the clinics, you will observe one thing. If you prescribe a medicine to the patient, and they will, and you think as a physician on the basis of your experience that the sugar values will be controlled on that medications, and many patients may respond and few will not respond. The only question, the first question you should ask that patient in whom the sugar values are not controlled by your medicines should be, are you taking the medicines regularly? And they would say no. Okay, and someone would have recommended them something, that concept of सियाना, फलाने सियाने ने ये बोला, फलाने बंदे ने ये बोला, हमारा वो बंदा था वो ऐसे ठीक हो गया था. So this concept you must be familiar with. So पहला क्वेश्चन ही जब आप उनसे करेंगे ना कि क्या आप में आपने डोज अपनी प्रॉपर ले रहे हैं, वो ले नहीं रहे होंगे. दूसरा, कुछ पेशेंट्स ऐसे होते हैं जिनकी शुरू में शुगर वैल्यूज कंट्रोल हो जाती हैं, लेकिन जब आप लंबे अरसे के लिए फिर वो आपको ना दिखाना छोड़ देते हैं. इसमें दो तीन एस्पेक्ट्स हैं. एक तो ये है कि फाइनेंशियल एस्पेक्ट, बार बार डॉक्टर के पास आने की फीस नहीं दे सकते, वो आने जाने का किराया आजकल नहीं अफोर्ड होता, डॉक्टर की फीस बार बार नहीं दे सकते. दूसरा, इसमें एक नॉन कंप्लायंस का एक इशू ये है कि आप मेडिसिन अफोर्ड ही नहीं कर सकते, ठीक है। तो आपने पेशेंट की नीड्स एंड रिक्वायरमेंट्स के अकॉर्डिंग उसको टेलर करना है सब कुछ, और उससे सब कुछ बड़े अच्छे से पढ़ा के भेजना है। और देखें, आप अगर पेशेंट अपने को 15 से 20 मिनट दे देंगे ना, मैं अपने हर डायबिटीज के पेशेंट को कम से कम 20 मिनट देता हूँ, उसे हर तरह से गाइड करके भेजता हूँ, ताकि और दे शो रिमार्केबल रिजल्ट्स। सो दिस इज द रोल ऑफ एजुकेशन एंड सपोर्ट, ओके। और आप उनको अच्छे से बकअप करें, अच्छे से उनको मोटिवेट करें, तो पेशेंट जरूर रिस्पॉन्ड भी करते हैं। स्पेशली शहरों में, जब शहरों में आप प्रैक्टिस कर रहे होते हैं तो नॉलेज वाला पेशेंट होता है, वो आपको रिस्पॉन्ड करता है। लेकिन मरीज को टाइम देना पड़ता है, जितना आप ज्यादा टाइम देंगे उतना आपके साथ वो एफिलिएट होगा और आपकी बात भी मानेगा। नेक्स्ट स्लाइड प्लीज। Okay, so lifestyle management, low refined carbs, high fiber. Yes, you will get the fiber in the raw vegetables like this carrots, and I suggest the eating of fruits like this apple. Okay, bananas. The role of bananas is very much controversial in the diabetes, in general, but you can take banana in the diabetes. Okay, and fiber content should be increased. If you cannot, then give them, prescribe them one teaspoon or tablespoon of ispragol husk daily. The more the fiber diet, the fiber, what does the fiber do? The fiber helps you in different ways, and also it helps you regulate the cholesterol levels. Okay, and cholesterols are usually removed via feces. And also the diabetics, they face issues of gastroparesis. What is gastroparesis? Gastroparesis is the decreased movement of the peristalsis. Okay, so what happens with that is the constipation. So constipation is a very common issue faced by the diabetics. So high fiber diet will regulate the constipation issue as well. Okay, exercise, as I already told, 150 minutes per week, moderate activity. Okay, and weight loss, 5 to 10% improves. Yes, weight loss. I will take 3 to 4 minutes at the end for the obesity. Okay, next slide, please. Okay, insulin therapy type 2, we have discussed everything here. SGLT2, insulin if needed, gestational diet first, then insulin next. Blood sugar monitoring, okay. Self continuous monitoring, and I already talked about the device continuous glucose monitoring, CGMs. So target value is definitely fasting. Okay, 80 to 130, but I keep it. There are two methods. There are two approaches in management of diabetes. One is the lenient approach, one is the strict approach. Strict approach says that the glucose values of fasting glucose should be 110 or less when patient is on medication. Okay, so strict control should be established, and the HbA1c should not go higher than the 6.4, 6.5. The other approach, that is the lenient approach, that says that fasting glucose can be kept up to 130, and the HbA1c of up to 7 is acceptable. Okay, and postprandial is less than 180. Few say 180, few say 140 to 160. Both approaches are correct. Okay, the lenient approach says that the in the lenient approach, the risk of hypoglycemia is lowered. Okay, but these days the medications that are available, they are very much, their effects are very much predictable. Okay, so the episodes of hypoglycemia are very few in number. So I go for the strict approach in my patients, and they respond well, and I have never encountered the hypoglycemia episodes with the newer drugs. Next. Patient education, disease and medication understanding, recognizing hypoglycemia. Yes, The 20 minutes I have told you that you must give your patients up to 20 to 30 minutes in whenever they visit you. So that education is basic part. You tell them the signs of hypoglycemia. What are the signs of hypoglycemia? Sweating, feeling low, fatigue, lethargy, confusion, okay, and paresthesias, tingling sensation in the feet or palms, okay. So these are all the signs of dizziness, vertigo. So all the signs of hypoglycemia, you must address them, and foot care is very important. Basically regular checkups of the foot, and also I usually ask my patients to just apply Vaseline once daily at night, minimal. Okay, what happens is that there definitely you must be familiar with the fact that there there is a dryness in the skin. There can be dryness in the skin, and there the cracks may appear in the heel area or foot. So what does Vaseline do is that it fills up those cracks, okay, and soothes the skin. So that helps whenever there is a crack, the bacteria can invade. So to avoid the infection, to avoid the diabetic foot, you just educate patient about the foot care as well, and also that you teach them that you should avoid the uh, 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 walking on the hot surface like on the roof when there is when it is exposed to the direct sunlight of the summers, and also you should tell them that whenever they face that they are not uh, perceiving the sensation, means when they develop numbness, when they develop peripheral arterial disease, when they develop neuropathy, they can walk on the hot surface and they won't feel anything. So you such patients of neuropathy, you should tell them that they should avoid uh, walking barefooted, so that they never get exposed to such things. Okay. Okay, so next slide please. And dental hygiene, oral hygiene, I already told you, and the lifestyle modification. New advances, yes, artificial pancreas. Okay, the stem cell or the pancreatic surgery is under the trials, and currently it is restricted for those type 1 diabetics in whom the strategies of insulin administration and they fail, but they are in the developing stages, and that's they will definitely be fruitful in the future. And the one insulin pump CGMs, I have already told you about this. New drug classes, I have already told you this. The GLP-1 is the semaglutide, SGLT2 is the empagliflozin, dapagliflozin. Digital health and telemedicine support, yes. I usually give my number to the patients. So what happens is that they share with me every query they have. Tell them that don't call me, just send me a text on the WhatsApp, and I will definitely visit that text. And I do read the WhatsApp messages of my patients. I have a separate number for my patients so that I can go through it and the text never get missed. So in that way, the telemedicine, this is the telemedicine actually. WhatsApp, the consultation on WhatsApp is also a part of telemedicine. So they get the support, they share their concerns, and this regular support to the patient helps them retain their track. Okay. Whenever they have some values that are uh, uh, problematic, they consult you and you can advise them some remedy at the spot. So this improves their overall health. Next slide. Conclusion: early diagnosis, proper management, lifestyle modification, control today for a healthy tomorrow. And yes, here I would add a few points about the obesity. Look, prevent obesity, and if you have obesity, do something about it. Don't ignore. Check your BMIs regularly. Look, BMI is a very crude form and a very helpful thing. Like, but now the people, they advise that you should check your waist size regularly. The waste should not be increasing. Okay. And so for people like you who are students, I would suggest you that go for the BMI only. BMI is very easy to calculate. Just you need weight and height. And these days you have the gadgets and calculators are available on the internet. You can just put the values there and you can get the answer. Okay, so less than 25 should be the BMI. Over 25 is the overweight, and over 30 is the obesity. And over 35, you need the bariatric surgery. But to treat obesity, because what happens is that obesity leads to diabetes. Okay. And then when once the diabetes occurs in the background of obesity, insulin resistance starts. So the much whenever you give insulin, you just keep on increasing the dose of insulin and still the patient doesn't respond. Why? Because there is insulin resistance, so the cycle continues. Obesity leading to diabetes, diabetes leading to insulin resistance, and the cycle goes on. The diabetes is difficult to be treated. The physician faces difficulty in controlling the diabetes, and that leads to the problems like stroke, MI, myocardial infarction, heart attack, in simple words, kidney failure, retinopathy, different forms. So that is why the GLP-1 semaglutide I was talking about, once weekly injection, that helps in weight reduction and that helps in treating diabetes. So FDA has approved recently for it was being used in the management of diabetes, but it wasn't being used in the management of obesity. And now the new research, the world is focusing on obesity treatment, because obesity is also the mother of all the illnesses. And one important aspect of obesity is that you must have heard about is the fatty liver. That is the part of the metabolic associated fatty liver disease and metabolic associated steatohepatitis. Previously, it was known as NASH, NASH, non-alcoholic steatohepatitis. Now it is the same thing is known as MASH, MASH, metabolic associated steatohepatitis or metabolic associated fatty liver disease. So what happens is that your liver starts deteriorating, okay, due to the fatty liver, obesity leading to the fatty liver, leading to the liver failure, leading to the death. Okay, I have just recently seen a patient around 1 to 2 months ago. They came to me, and the patient, only his main symptom was, डॉक्टर साहब मेरी ना पेट फूल रहा है, तो मुझे लग रहा है मुझे शुगर की वजह से हो रहा है. He was a diabetic already, and as he was a diabetic, so the first thing came to my mind is the liver. So I went on to perform certain tests for his liver, and there was liver failure, and ultimately the liver failure was at very advanced stage. So he died because that was inevitable, and it is a silent killer actually. There was no symptom because of his diabetes. The symptoms was mixed or ignored, and that has led to the liver failure. And it was too late to do something about for him. So this is how the obesity. That is why I was focusing on obesity. That do take the treatment of obesity in my clinic. I treat the diabetes and I treat the obesity at the same time, because you cannot imagine controlling diabetes without controlling obesity. Okay, so if there is obesity, do treat the both problems. Thank you so much.
Thank you so much, sir. Okay, guys, thank you for your attention. Now it's time for your questions. If you have any, kindly drop them in the chat box and sir will respond to them one by one. Guys, kindly drop your questions in the chat box.
Sir, share the question first. I think we should go with that first. Sir, you may reshare your question.
Okay, which question? How can we reduce unawareness to take their mild symptoms seriously? Look, the gadgets are in everyone's hand. The proper use is actually the main thing we should focus on. Uh, Okay, so awareness, there are several platforms of awareness. These kind of webinars are a platform of awareness. You students are a part of can spread awareness. When you will teach your families, they will then spread to the others, and then this way, whenever we sit, whenever we friends sit down, we discuss different topics, but we never discuss constructive topics. So this is how you can spread. Gadgets are in everyone's hand. Even in the rural areas, people have mobile phones. So the platform for awareness is there, but the access are developing the habit to get that awareness important. And then you can spread pamphlets, television, and different things. So these days, diabetes and obesity is a very important topic, and people are discussing that. And then there is a question, healthy diet versus oral hygiene, which plays an important role in development of diabetes. Look, both are important. You cannot differentiate them. Oral hygiene is also a part of healthy health and okay, healthy diet. Look, both are important. Definitely, healthy diet is more important than the oral hygiene because oral hygiene is one of the factors that can cause diabetes. But poor diet will definitely cause the diabetes. You guys can ask the question and the answer. Tell the diabetic periodontalgitis. It is the inflammation of the gums and the bone. And it also exacerbates the diabetes by increasing insulin resistance. Is there any chance of transferring type 1 and gestational diabetes from mother to baby, and how can? Yes, I have already told you that the diabetes can run in families. So if the mother or any family member is prone to any form of diabetes, and the children may have diabetes as well. Healthy diet versus oral hygiene, which contributes more to the development of diabetes. Okay. Bell's palsy related diabetes as first clinical no. Bell's palsy can be the first manifestation in a way of type 2 diabetes, that in a way that Bell's palsy can be caused by different viruses. Bell's palsy can be caused by after acute infection, acute viral infection, and it is also happens in the diabetics. So yes, but it is not actually a symptom of diabetes. Bell's palsy can occur in any form, but yes. But usually the diabetes, first manifestation of diabetes is the in type 1 diabetics is the diabetic ketoacidosis, and in type 2 the different signs, polyphagia, polydipsia, and gastric symptoms, and these kind of things. Any role of CKD? Why not? Any role of CKD? Diabetes causes CKD, as discussed. Nephropathy is chronic kidney disease actually, and then if there is if there is CKD due to the autoimmune causes, then definitely diabetes can happen in that patients as a another autoimmune disease, as it was discussed earlier that diabetes is an autoimmune disease, type 1 especially, and autoimmune phenomena, diabetes can occur due to the autoimmune. And yes, one important point here is that now the research recommends that you must carry out the autoimmune tests in the middle-aged to young people, so that the type 2 diabetes can be diagnosed at earliest. I can wait whether is having. Look, first important differentiation is the age between type 1 and type 2. Type 1 will occur very early in the age process. Second is the role of anti-insulin antibody, or you can check the protein C levels. What is protein C? You must know that it is a part of the insulin. Okay, so they are almost equal. So if insulin is being produced, then protein C must be, being must be there as well. So you can test the protein C, and if there is absence of protein C, then there is absence of insulin, and then it might be type 1 diabetes. Sir, I have researched on this topic. Most of the patients I see we diagnosed Bell's palsy before diabetes. Look, diabetes is a chronic process, as I already told you, that it can occur at any stage and multiple factors can lead towards diabetes. So you must have seen Bell's palsy in those as well. And then definitely if it is your research topic, you can research on it. And Bell's palsy can occur in diabetics. And usually what happens is, for example, a patient develops Bell's palsy, he goes to the clinic, several tests are performed, and that the diabetes is diagnosed usually. So this is how diabetes is diagnosed, because there is no screening protocols in our country. You are not screened for. How many of you go regularly to the doctors to get your BP checked, to get your sugar values checked, to get your LFTs get checked, to get your renal function test done? Nobody goes, okay, in the routine. So when they develop Bell's palsy, they start visiting the clinics, and in that they get monitored and they may be diagnosed with diabetes as well. So this is one, and this relationship is there because Bell's palsy can occur in diabetics. Any other question? Sir, my personal internship duration experience, I wanted to be public hospitals. We lack variety in drugs. A patient. Definitely, if you have normal blood sugar level, it definitely means that insulin resistance either has not developed, or if there is insulin, there are sufficient quantities of insulin in your body that they may be overcoming the resistance and still performing the function. So insulin levels are very important. As I have already told you that in type 2 diabetics, there is insulin, but either insulin is insufficient or there is insulin resistance. And the insulin levels are not able to overcome that resistance. Okay, so there are several factors in that. यार ये जो लॉन्ग एक्टिंग और ह्यूमुलिन वाला सवाल आपने किया है ना, एक तो गवर्नमेंट का, एक तो क्वेश्चन थोड़ा सा मुझे इतना अच्छा आइडिया नहीं हुआ, लेकिन जो इसमें इम्पोर्टेंट बात ये है कि डोज बहुत जरूरी है, कि आप डोज मेंशन करते हैं ना, कि क्या वो था. 58 years old male patient had raised glucose levels in the past few years, which are controlled by now with the medication of metformin, but he's still taking the daily dose of metformin, where the levels may rise again. Should he continue, because the adverse effects due to overuse of metformin may appear? Usually, metformin is a safe drug, and those who face the side effect usually face it at very early stages. And diabetes, usually, if once developed, it doesn't get treated on its own. So medicines are required to be continued. And important aspect, if someone is diabetic and now suddenly his values are becoming normal, you must check his RFTs. You must check that patient for retinopathy, because if he has nephropathy, the glucose might be he might be losing glucose via urine. Okay, and that is not normal. That shows that he has developed nephropathy. He is diabetic, but he has his glucose values are being shown to be normal because he is losing glucose through urine, because his kidneys are not absorbing the glucose. Reabsorption is not occurring. Diabetes is also related to stress, right? Yes. the most common one of the most common risk factors these days is the stressed और एक इम्पोर्टेंट इसमें बात यह है कि आप चीनी जितनी मर्जी खा लो ना आपको शुगर नहीं होगी ठीक है जो रिस्क फैक्टर्स हैं अगर वो नहीं है आप में मतलब आप थिन लीन हो आप एक्सरसाइज रेगुलरली करते हो ये वो तो आप लेकिन अगर आप थिन लीन हो एक्सरसाइज भी करते हो सब कुछ करते हो लेकिन स्ट्रेस लेते हो ना तो आपको शुगर हो सकती है तो स्ट्रेस इज अ वेरी इंपॉर्टेंट रिस्क फैक्टर ओके जी वी आर डन विद दिस
Yes,
Salome,
sir.
sir. Sir, thank you. Sir, I am Muhammad Adil from MIMCLC, President
Okay.
of CLC. Sir, thank you so much for this session, for this insightful session. It was great. Many of our queries got answered, many of myths have broken, many of facts.
Thank you so much. Thank you so much, everyone, and thank you so much to the forum for inviting me and giving me the opportunity to just share my knowledge with the students. And I try to keep it simple and elaborative so that you can utilize this knowledge at your home. Look, almost 60 parts, there were 60 participants, and it means that 60 families can get help. Okay. And you might be able to diagnose diabetes at early stages, or you may be able to help them follow the good lifestyle, and you may be able to help them reduce their obesity. Thank you so much.
Okay, sir. Thank you once again for being with us. All right, everyone. We would love to capture this moment together. So please turn on your cameras for a quick group photo. जो भी कंफर्टेबल है प्लीज अपना कैमरास ऑन कर लें ताकि हम ग्रुप फोटो लेके सेशन को एंड करें आई होप एवरीवन इज रेडी Okay, Adil, please capture.
In just a minute.
Okay. I hope it's done.
Yeah.
Okay. Thank you everyone for joining us. And now please don't forget to fill the post-evaluation forms for your certificates. Thank you so much. Jazakallah.